I was 5 years old. I received a severe burn on my left arm, and I was undergoing the treatment at the hospital. While I was doing the treatments, acquired hospital infections, and my whole body was covered in boils. So we were continuing treatment, but it didn't work well for a long time. So my parents were desperate to look for help, natural help. We were using different remedies, herbal decoctions, and that's actually helped me to clear the infection. But this experience stuck with me, and I decided to pursue my medical field experience in my future life. After finishing the university, I was working at a hospital as a neurologist, and we had a lot of patients with headaches, anxiety, depression, post-stroke, Bell's palsy, multiple sclerosis. So that's where the chronic patients, so they were going for treatments twice a year, and in between they had some treatment plans just to maintain remission. And at the hospital, we were using different modalities along with pharmaceutical medicine. We used different nutrition, acupuncture, massage therapy, physiotherapy was part of the treatment, and of course different vitamins and minerals that were used in injection form at the hospital. And when people were going home, they were given the same forms, same vitamins in pill form, so they could continue treatment at home. Then when I moved here to Canada, I was really surprised why those medicines are really divided. Conventional and alternative medicine are completely separate entities. But because I was much more close always to the natural medicine, I decided to pursue my field into naturopathic medicine.
What is
It's like a lifestyle. Includes healthy eating, activity, includes different supplements that you are taking maybe on a daily basis. Maybe difference between the conventional medicine that we are trying to be very gentle and using our inner sense, inner power to heal the body. So the less medication is the better, and we are trying to treat the root cause. For example, if you have stomach conditions and you're trying to take acid blockers, so kind of to decrease the acid in your stomach, but maybe actually the real problem is your stress, and you have to cope with stress, to manage stress, then you will have kind of disconnection with stomach, and you will have less pain when you will have less stress, or you will learn how to cope with stress. So again, naturopathic medicine is trying to treat the whole person instead just of covering the symptom. As medical doctors as well, they can treat any common complaints, and we have a lot of successful cases with treatment of anxiety, depression, digestive complaints like maybe heartburn, constipation, stomach pain, high cholesterol or blood pressure, different allergies or hormonal disbalance. So, but basically any condition, it could be treated with naturopathic medicine. Even if you're taking medications, so the naturopathic doctor will carefully check the interactions and will try to maintain in such a way that you will have either less side effect or the condition will be stabilized. So you will not have, as usual, to increase the dose of medication, but maybe on the contrary, you will need to decrease the dose of medication and eventually to get off the drugs. If you need, for example, maybe the prevention, if you are undergoing for the surgery, so natural remedies can help you to feel better, so to speed up recovery after the surgery as well. And it could be just combined with any medical treatments that you are taking right now. Successful patients with different conditions, so it's anxiety, depression, digestion concerns like maybe heartburn, stomach pains, like cholesterol, diabetes, and many others, because actually naturopathic medicine can help with different concerns, and that's no matter if you are taking current conventional treatments, naturopathic medicine still can be used, because we can help you to at least maintain the dose or prevent for dose increasing, or maybe just help you to get off the medication by changing, again, using different modalities of naturopathic medicine, changing your diet, adding some supplements or herbs, and that will help you to decrease the medication that you are taking, or even if you are undergoing the surgery. So naturopathic medicine will help you to be prepared for the surgery and speed up the recovery after the surgery. So again, it could be helping in any condition. Of course, if you have a family doctor, the treatment plan can be maybe just in addition, provided with some natural remedies as well. Why it's important actually to have both doctors, because if naturopath can help you and do different blood work in saliva, family doctor can arrange for you the X-ray and the ultrasound, and then based on results we can create a complete treatment plan. So if you need the medication, or if you need in addition the natural remedies as well, so we can kind of combine the treatment plan to achieve the optimal results and optimal health for you. A huge variety of different naturopathic modalities. So usually we are starting our treatment plan with some lifestyle changes. For example, if you're going too late to bed and have not enough sleeping hours, so obviously your fatigue is related due to the lack of sleep. So maybe that should be adjusted. Some nutritional changes, of course, could be done, and especially we can do maybe food sensitivity test to eliminate the foods that promote the inflammation in your body. Homeopathic remedies, so this is the remedies that using only energetic power of plant, and there is no molecular substances of the plant, and they treat like similar symptoms that usually they cause with the overdose. Acupuncture and traditional Chinese medicine, this is the part of naturopathic medicine as well. And beside that, we can do different supplements, so vitamins and minerals and amino acid could be added to treatment plan, or herbal remedies, tincture and capsule forms for treatment. Body work can be done with naturopathic medicine. In addition, bioidentical hormone replacement could be prescribed, especially with female with hormonal disbalance or maybe thyroid problems. We do have special technique called heart math technique that help us to achieve good results in patients with stress, anxiety, depression. So that actually a technique that teach you how to meditate properly and how to decrease stress and anxiety, and it's a program on the computer that helping you to overcome the emotional stresses. Mostly acupuncture is used for musculoskeletal problems, but acupuncture can be used to treat the internal organs as well, kind of because meridian runs through our body, but they reflect the inner state of our physical organs or emotional state. So again, like for acupuncture, we have to assess your pulses and your tongue, and as well we're asking like what kind of symptoms you have to create and choose the proper points. In terms of painful is it or not, it's definitely you feel when it comes through the skin, but usually after your pain subsides, you might feel the sensation of chi flow or maybe numbness. You feel that your arm or leg become kind of sensation of fullness, but that's normal. It just helps you to feel the energy flow, that maybe the block that was in your body, it's now dissolved. And if you do a right acupuncture, so we have different sizes of needles that can be used. Even we have the sticky needles, or we can do the acupressure just to help you that works and make you more comfortable even to try and the acupuncture in future. Visit, we are doing intense physical exams, so that means we can check your blood pressure, check your eyes or ears or reflexes, so that's kind of physical exam. But when needed, we can do the blood work as well. Basically, most of the tests that our can order, and in addition, some additional tests, for example, the food sensitivity test that usually regular doctor will not do, can provide information about, how you tolerate different products. We can do different tests for your hair and urine, and that give us the full range of knowledge about your hormones, maybe cortisol, female or male hormones, and toxicity or different indications about how your metabolism, how your body is working. All of this data can be used for creating the diagnosis and treatment plan for the patient. But in addition, we require the diagnostic test from your medical doctor, like tests like X-ray or MRI, ultrasound, can order only the medical doctor. So usually we're just asking about those results to incorporate in our diagnostic and treatment plan.